What's Up, Doc Mike? Public Health on Call, by Johns Hopkins Bloomberg School of Public Health. Today's topic for December 21, 2020, Backstage at Public Health on Call. Thank you, Johns Hopkins Bloomberg School of Public Health.
Welcome to Season 2 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement, and a former secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
Hi, I'm Lindsay Smith-Rogers, producer of the Public Health on Call podcast. This podcast has had over 3 million downloads since we started back in March, and we receive a lot of questions from our dedicated listeners. Many of these questions are about the podcast itself, so today we thought it would be interesting to get those questions answered. So I've invited Josh Sharfstein and Stephanie Desmond to join me today in our respective home studios while I ask them some of these listener questions in a very special episode, Backstage at Public Health on Call. Let's listen. Josh Sharfstein and Stephanie Desmond, it is an honor and a privilege to be interviewing both of you for this special episode of Backstage at Public Health on Call. This podcast started on March 3rd, if you can believe it, and we're going to be ending season 2 with 225 episodes in the can. And Josh and Stephanie, you have been our regular hosts, and I know now very familiar and trusted voices that have been guiding our listeners through a really difficult, confusing, and frightening time. But today we are going to lighten things up just a little bit and take some of our listeners backstage, so to speak, of Public Health on Call. So I want to start out by talking about how this whole podcast came to be. So Josh, I want you to take us back what feels like 27 years to late February 2020. How did this even happen?
First of all, Lindsay, thank you for everything you've done for Public Health on Call. I remember the early period of the pandemic and just realizing how many questions I had and how many people at the Johns Hopkins Bloomberg School of Public Health had answers. And I was calling around because media were in touch with me, or elected officials were in touch with me, and I was finding a virologist, an epidemiologist, clinicians, and others. And I'm a big podcast listener, so I thought, boy, these conversations are so interesting. Maybe we should have a podcast.
And did you already have a mic at that point?
I did not have a mic. Actually, okay, I'll be honest. I had a little teeny mic that we were using because we had the American Health podcast. And I knew I could get access to that. So it was like a little special mic. That's all I had access to. But I didn't have my mic, which has been my trusty companion through the whole pandemic for all of my Zoom calls. When we started doing this, someone in the studio at the School of Public Health gave me a real tutorial on audio and told me which kind of mic to get. And I got that relatively early in March.
And now we all have mics. So you have some experience hosting a podcast, but Stephanie, have you ever hosted a podcast before? I know you have a very extensive journalism background, but has podcast hosting been in there?
I have never hosted a podcast before. I had never been a guest on a podcast before, but Josh called me in early March and he said, we're doing this podcast and I think maybe I'd like you to be my co-host. We're doing this daily podcast on COVID. And I said to myself, daily podcast on COVID? How could we possibly have enough to talk about?
I remember that conversation, Stephanie, because you said, if I recall, I think I might have a teeny bit of time for this.
It's become a lot more than that, hasn't it?
Yeah, I think when Josh initially pitched this to Lamari Morales, who's one of the executive producers of the show and actually my boss, you said, we're going to do a daily podcast. It won't be that much work. Don't worry. So I do have to ask, have either of you ever been recognized by your voice now that you're podcast famous?
I don't think I've ever been recognized by my voice in quite that way, although I do hear from people that they like the podcast. So that's nice. And sometimes I'm talking to people and they'll say that they've heard me on the podcast. So they know who I am. It's not like they've they've heard me in the store. Of course, I'm hardly ever in a store, but we're on a Zoom or something and they'll say, I just want to let you know, they'll send me a little note. I particularly like this episode. Often it's an episode that Stephanie did.
I'm always walking like that. In every bit of free time I have, I walk. I've been obsessive about walking during the pandemic. But I will tell you, I was walking a few weeks ago and a neighbor friend who's actually a physician stopped me and said, I'm listening to you right now.
And so I just want to go back to what you said, Josh. I know that we have some fans in some faraway places, including Alaska. Is that right?
Yes, we've heard from Alaska. We've heard from many parts of the country. We get so many interesting emails in. We try to answer listener questions as best we can, but it's been nice. I particularly appreciate the emails we get where a particular episode has helped somebody cope with a difficult issue, either medical or psychological, or just just some of the episodes that we've had where people talk about how to get by, in the hospital, for example. Those really are meaningful to us because it can be pretty isolating when you're recording the podcast by yourself at home. It goes out into the world, but it's nice to know that there are people who are listening who appreciate it.
Yeah, and we've gotten quite a bit of feedback. I think the one that has struck me the most was we got one email from someone that lives alone in a retirement community and has been listening to every single episode. We've also gotten feedback from people that say, one person listens to it every day while she walks her son in his stroller and says it's the highlight of her day. And we also have heard some feedback, Josh, that you have a wonderfully soothing voice, like, quote, an academic Fred Armisen, unquote. And we have not let you live that down since we heard that. And what was your response to that?
I consider that a very high compliment for people to think that I have a voice like that. But yeah, I know. I'm hoping that I can get my parents to listen to this at some point.
That's your goal? Yeah,
exactly. No, I'm just kidding. They're listeners, and I will get honest feedback from my mom, like so episode today, Josh. So she's definitely, sharpening her pencil when she listens, and she lets me know. But when she says she likes the episode, that still feels good, even 50 years later.
So she'll have some notes for all of us after this, I'm sure.
It's quite possible.
Okay. So let's recap some episodes from the last year. We've done a couple of episodes that we refer to as Josh's Book Club. We've talked about the plague. You've talked about An Enemy of the People. I know that you were trying to work your way through The Stand. Did you finish it yet?
I have not finished The Stand. That's a novel by Stephen King, which I thought might have some relevance to the current pandemic. But by the time I got to the point that pretty much everyone had died in the United States and it was kind of a post-apocalyptic anarchy, I stopped. My reading kind of trailed off, and I thought maybe it wouldn't be that great a podcast episode.
Not much to learn from there.
I mean, it's an interesting book, but not maybe quite as on point as I think those other books are. I mean, The Plague has so many interesting parallels to the time that we're in, how the virus has exposed inequality in our society, how people cope with uncertainty, so many important lessons. And that podcast with the chair of the English department at Johns Hopkins was just so fantastic. And the Enemy of the People really resonates at a moment when so many public health officials are getting attacked. So I thought that both of those were really relevant, and The Stand didn't make the cut in that way.
And any other suggestions now for pandemic literature?
Well, I'd love to get some. Maybe listeners can send in some ideas, and we can track down some experts or just avid readers to talk to us about them.
That would be a good idea. Yeah, you can email us at publichealthquestion@jhu.edu if you have any suggestions for books that we should be reading. Stephanie, I want to go to you and talk about the fact that you have hosted episodes with one of our most recurring guests, which is our clinical psychologist, Laura Murray. She is a 6-time podcast guest. I had to go back and look. The first episode that we did with her was episode number 67, which was released on May 8th. And there you talked about mental health care and doom scrolling. I know you've gotten some feedback on these episodes. Can you talk to us about that?
Well, I think what I've heard the most is that people really like to listen when Laura and I talk. She is sort of a really good, reassuring voice, and she helps talk us through sort of what is the kind of reaction you should expect during this kind of isolating pandemic, and when you might need to see somebody to talk about issues you're having. And people have said to me that they think it sounds, like they're sitting in on a therapy session. And so I'm glad sort of that I can bring that to people.
Yeah, we can't wait to have her back again soon. I also want to talk about our Friday Q&A series, we have this all-star lineup from the Johns Hopkins Center for Health Security, where Josh and these guests will sort of rapid fire answer listener questions that we get to the email. And our experts are pros at maintaining composure, even when the questions might catch them a little bit off guard. So Josh, you recently asked Imesh Adalja in episode 186, which came out on October 23rd, the following question: can waxing your nose hair put you at risk of COVID-19? Can you bring us into that moment and talk us through what happened then?
Well, I would say Dr. Adalja really is a serious interview. He answers every question on the merits. It's hard to rattle him in any way as we're going through all these different questions. But I had, for a fleeting second, a hope that question might make him pause a little bit. But absolutely, he was up to the moment. He just took that question. He talked about the role of the nasal mucosa and nasal hair in the infectious disease response. And he gave his answer, which I won't repeat here because I think people should go back and listen to that episode.
Yes. And again, you can send us really any questions and we will try to get to them. There's really nothing off limit in terms of what we'll try to cover. So let's talk about some of your favorite interviews. So Josh, I wasn't sure which one might be more your favorite, talking about the NBA bubble or talking about books that you've read. But can you tell us, out of all the interviews you've done, which one was your favorite?
I wish I could, but the truth is I really appreciate that people take time to do the podcast with us. And there's so many of these interviews that I learned so much from. So I don't think I can give a favorite. I certainly enjoyed the NBA one. I learned a lot. I'll tell you what I remember from that one was when Pete said that the way that players got through the incredibly restrictive environment that they were placed in during this entire period, like weeks and weeks isolated, was keeping in mind that it was temporary, that there would be an end, that there would be a championship trophy. And in a way that made me think, that's what we all have to do. I mean, this is so hard. But it was a bit of a metaphor kind of hitting me right in the face that, everybody is struggling, but it is not forever. Especially now that we see a vaccine on the near-term horizon, it's not forever. And if, the NBA players can do it, then, we can do it. That was kind of the conclusion of the episode.
And Stephanie, you have interviewed quite a few national experts as well and people on the front lines. So who were some of your favorites, or what were some of your favorite topics?
Well, like Josh, it's really hard to pick a favorite. I will say that I love talking to, people who are really living this every day. I thought that just a recent episode I did with Lacey Gooch, who is a nurse, an ICU nurse in Nebraska. She is holding it together like you wouldn't believe, but there's just so much suffering and so much pain that she and her colleagues are seeing every day. And there's so much more they wish that they could do. And I think, what stuck with me was that she had this message of, wear your mask, this is real. And, that's what keeps me going, is that there's still so many people who aren't listening to the basic public health advice and keeping themselves and others safe. And so anytime we can show that concept through the eyes of someone who's really living it every day, I really want to be able to tell that. And I think there's sort of another, this whole sort of dynamic that we're seeing. We have number of cases and we have number of deaths, right? And we think of it as basically mild versus death in this situation. But there are so many people who are experiencing quote unquote mild symptoms who are still really sick. And so the episode we did on long haulers was really meaningful to me because I don't want people to forget that this is a really serious illness. And even if you have a mild disease, you can have long-term consequences from it.
Yeah, I think this podcast has, as Josh said earlier, it's really helped all of us to even understand and get some questions answered that we have been pondering to understand this pandemic. So, Stephanie, who would you most want to interview? Who's your dream guest?
Oh gosh, you did not tell me that was going to be the question.
No, I caught you off guard. And Josh, I'm going to ask you the same thing.
I'll tell you that I loved interviewing Josh. I love when I get to interview Josh. That's one of my favorite things to do because he is really, really knowledgeable about so many aspects of this on his own. And he does this great job asking questions of others, but he really brings to us, he's got such a varied expertise. He's been a high-level administrator at the FDA. He's run a state health system. He's an academic. So I love talking to Josh. My dream was to talk to Anthony Fauci, but the dean beat me to it.
Yes, we did get him on the podcast, but it was through a webcast event. Josh, who's your dream podcast guest that you would like to interview?
That is a good question. I can think of a lot of different podcasts that I would like to listen to, and so that's kind of how I think about it. There is this phenomenon now where people who really didn't think that the virus was that serious or maybe even that it existed are getting sick and having to cope with the dissonance of, actually getting sick. And we've heard some stories about that. I think I would like to listen to a podcast where, that whole process gets exposed a little bit and people are honest and sharing, why they felt one thing, how their mind was affected by getting sick in one way or another, and where they have landed as a result of that. I find that to be such a poignant type of story to read. And I think in a way it's important for people to understand what the virus is about, but without fully blaming themselves. I mean, we're living in such a difficult time and there's so much polarization. I think that through those kinds of stories, there may be a way not to make, certain people feel bad, but for people hopefully to come together a little bit more in fighting this common enemy.
Yes, we've interviewed quite a few frontline healthcare workers, but we haven't really talked to anyone who's been a patient themselves. So if anyone is listening to this podcast and wants to share their story, maybe even a story where they started out, not knowing as much about COVID and where they are now, please feel free to email us. We'd love to have you on the show and have Josh interview you. So I do have to address something here, and that is the fact that, so we're doing these interviews from our homes and we're on this Zoom call. And over the last 10 months, we've been having these once a week production meetings over Zoom. And I've noticed in that time some changes in Josh Sharfstein's background. I understand that on May 13th, you scored a 7 out of 10 on the Room Raider Twitter account. It looks like you had made some adjustments after that. And then on June 23rd, you landed a strong 9 out of 10. Can you tell us what went into that score?
I don't know if I can fully get into the strategy that I used for that, Lindsay. No, seriously. I think basically they said, please put something on your wall. So I saw that on Twitter, and actually I went into my office because one of my favorite posters that actually I got from my parents is the World War I poster, "The health of the child is the power of the nation." And so I brought that home and I put it up behind me. And it's great because when I'm looking at myself on a Zoom, I don't like to look at myself. I look over my shoulder and there is the health of the child is the power of the nation.
That's very powerful. And the composition is just lovely of the art on your walls. But I do have to say, though, we have kept tabs on some other Public Health on Call regulars. Back in May, Crystal Watson scored a 9 out of 10. We do know that Tom Inglesby is currently in third place with a 7 out of 10, but he may be bumped now that Jennifer Nuzzo, who scored a moderate 6 out of 10 back in July, she added a very nice potted plant that commentators have mentioned could bring her score up to an 8 out of 10. We have to know, Josh, do you have any plans to go for the coveted 10 out of 10 on Room Raider?
Lindsay, I think you might be spending too much time checking this all out. That's my conclusion from this. I would just say a 10 out of 10 is something that people can dream about, but you really can't stare right in the face and say that you are hoping for it. It either happens or it doesn't.
Well, I mean, one of our quarantine hobbies has been the Room Raider Fantasy League that we have going on the side. So, what else are you going to do? So we are just a couple of weeks out from Christmas and Kwanzaa. We're getting close to the new year. But both of you already have some pandemic holidays in the books. And in fact, Josh, the Baltimore Sun featured your family in an article back in April about a Passover Zoom and how you all managed to continue with some family traditions. So can you talk to us a little bit about how you were able to share that family meal?
Well, what happened was I did a session with the city council president, who is now the mayor in Baltimore. About 5,000 city residents dialed in, and one of them asked what he should do for Passover. And I hadn't really thought of it. And I realized that we were not going to have a usual Passover with my family, that it would have to be with Zoom. And that has been something that I've done every year since I can remember. And when I was responding and saying, it's just not safe to have a big, family gathering at this point, my voice kind of caught. I just was thinking about my own family. And the reporter who was covering the city council president called me afterwards and asked to be able to cover the Zoom. So I had to clear that with my brothers and sisters and everybody. And sure enough, she wrote a great article, Talia Richmond. And, I think it captured how we were still able to have kind of the family spirit there. My mom left some haroset outside for us to pick up. And we were talking about it. We're the family that's closest to my parents. So we were the ones who got the haroset. So my brother and sister were a little jealous of us. But, it was meaningful. And we recently did it again for Thanksgiving.
And Stephanie, your family is also planning to stay put. How have you been handling the holidays this year?
I had to make my own haroset for Passover, first of all, which I do not do. My parents live far away, so we catch up when we can on Zoom. We did a Zoom Passover. We did a Zoom Thanksgiving. I will say that my in-laws live in town, and I'm sort of public enemy number one because of everything that I have learned from this podcast. I know how unsafe it is to travel and to be, with elderly people. My in-laws are in their 80s. My father-in-law's almost 90, and I worry about them so much. And so I have really tried to stay away as much as possible. And I am a little judgy about people in my family who get together, maybe when they shouldn't. And so I'm maybe not the most favorite daughter-in-law these days.
I think a lot of us have had those moments with our friend and families as we try to navigate, what works best for us and finding that balance between safety and being able to spend time together. And that will continue to be a struggle. So we only have a couple of minutes left. So there's another thing that we have to talk about, and that is the fact that there is an enormous amount of work that goes into this podcast. And we have an incredible team behind the scenes of just talented, I call them artists, but they are our audio engineers, the people who actually mix the audio that you hear. And they edit out a lot of stuff that our audience doesn't need to hear and that can get in the way. And then Stephanie, you've actually had an oops moment where you recorded an entire podcast without hitting record.
Now you're picking on me. So I had this great interview with these two doctors at Hopkins about cytokine storms, which are the overwhelming immune responses that were causing organ failure in COVID patients. And it was great and it was fabulous. And as I was about to say thank you for joining me, I noticed that I had not pushed record. And not only was it embarrassing because it was embarrassing, but I had never met these folks before. They didn't know me from a hole in the wall. And I was not pleased with that. And I would like to say that I learned that lesson. But I did actually, Laura Murray and I had one episode that I failed to record and I had to do over again. So yeah.
But you did both of those episodes over again and they both came out. Everybody was a good sport about it. And everybody
was a good sport about it, though. I don't know if I would have been if I were them.
Well, they got a chance to kind of, I think a lot of times when people record a podcast, they're like, oh, did I sound Did I sound dumb? Did I answer that correctly? So they got a second chance to go back and say whatever it is they wanted to say. And then Josh, we did actually, this is not a public health on call moment. This was actually a Facebook video that we did with you on emergency use authorization. And you had very carefully set up your background again, because you're going for that perfect 10 out of 10 on Room Rater. And it wasn't until we were going into the editing portion of the video that we realized that your dog was sitting behind you, but there was something else going on. Can you talk us through what people might see if they go and they dig up this video on Facebook?
Well, she is my companion in my basement office here. And unfortunately, she had a sore paw, which she kept trying to bite at. So we put one of those cones on her to keep her away from her paw. And she was a little glum whenever she had to wear the paw. Fortunately, she has progressed past that. But I think she was behind me wearing her cone and looking a little bit down in the mouth at that moment.
Yes, and people can go and find that video. Again, it's on the Johns Hopkins Bloomberg School of Public Health Facebook page. That particular video is explaining emergency use authorization. It's very educational, but then in the background, there's a nice little Easter egg for those of you that go and look for this. So I'm going to round this out now. We're going to be offline for a couple of weeks from December 21st, returning January 4th for the launch of season 3 of the podcast. And I want to talk just really briefly before we end about what you think we can expect in the months to come. So we're likely going to cover vaccine rollouts, continued advancements in science and research. What are some other things that you think we might see in the coming months as we continue to cover the way the pandemic is impacting so many areas of public health? Let's start with you, Stephanie.
I'd like to talk again to some more people about the impact that COVID has sort of maybe beyond science. We are seeing really dramatic issues, economic issues in this country. We're seeing a lot of people who are food insecure. One of the more interesting podcasts I did was about the eviction crisis that was looming. And we're going to see sort of what comes from that, I think, in the coming weeks and months. And so I'd like to touch on those topics as well.
And Josh?
Well, I think if we are able to make it through this current storm of COVID that we're in, we're going to enter a phase where we're going to be really making progress on the pandemic. And how that is happening, the people who are making that happen, the challenges that come up, how those challenges are overcome, all those are going to be great and important stories. I also think that we're going to keep doing something which we did a little bit in the last few months, which is bring in some other important public health issues that really deserve people's attention. I think the pandemic is front of mind, but not too far away are these other major challenges. The opioid epidemic, or the overdose crisis, I should say, is continuing to claim many, many lives, more than ever, actually, more lives than ever. And we've started to do a few episodes there. I think from time to time, we're going to want to check in on what's working and how we can actually push that epidemic back as we're seeing progress on coronavirus. And I think we'll continue to cover racism and racism as a public health issue. Some of the best, most impactful episodes, I think, related to this topic. And it has a lot of implications, both for the COVID response and well beyond.
Yes, and I think we're also going to be touching on climate change and mental health and health equity, which are all equally urgent public health issues. But for now, I want to thank both of you so much for your time and for lending your voices to this podcast. I know our listeners appreciate it. Josh and Stephanie, thank you so much. We wish you a very, very happy 2021.
Thanks so much, Lindsay. And I want to really take this moment to thank you and everyone on the team, everyone from the audio engineers to the people who figured out how to get this onto the different podcast stations and get the word out, and all of our interns too, who've really just made a huge difference. Everybody that's been part of this, it's really been a great pleasure.
And Lindsay, you've done a great job. I know this is your first time hosting a podcast, and I think you have a bright future ahead.
Well, thank you. I had 2 very great guests. So, all right, thanks.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmond, and Lamari Morales. Audio production by Spencer Greer, Niall Owen McCusker, Cian Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Thank you for listening.